Good morning, good afternoon, and good day, colleagues. My name is Mpho. I'm a registered nurse and a midwife. I come from Lesotho, and I'm going to moderate this session together with Rafiat. Rafiat, would you please introduce yourself?
Good day, everyone. My name is Rafiat. I am a registered nurse from Nigeria, and I'll be moderating this session together with Mpho. This is one of the first of the many series of our webinars that I'll be hosting. And then I am so excited to welcome you to our first webinar. In this webinar, we'll be discussing about the challenges to COVID-19 vaccination, and then also each of our advocacy immunization champions. We'll be talking about their challenges and how to build the gap in COVID-19 vaccination in their localities. It's a pleasure being here, and it's a pleasure having everyone in here. Thank you very much. Mpho, we can start over.
Thank you very much, Rafiat. Colleagues, ladies and gentlemen, our today's keynote speaker will be Thembeka Gwagwa. Thembeka Gwagwa is a nurse by profession. She was the president of the ICN, the second president of the International Council of Nurses. Colleagues, Thembeka was the founding Secretary General of the South African Democratic Nurses Organization, DINOSA. Thembeka, welcome, and colleagues, let's all welcome Thembeka. Ma'am Thembi.
Thank you very much, Mpho. And good evening, afternoon, morning to everyone. Let me begin really by thanking the organizers of this webinar meeting for inviting me to share my ideas on this important topic, which is overcoming challenges to vaccine, an opportune time for nurses to raise their profile and their immense role in healthcare delivery. It is now. Opportunities come and go. We need to be better organized than ever. We now talk about these concepts, vaccine equity and vaccine acceptance, because of COVID-19 that has profoundly affected lives of people around the globe. It has also reminded us of the wealth inequalities that exist in the world. There is an ongoing debate and concern regarding access and vaccine and COVID-19 vaccine and rollout gaps in the low-income middle countries compared to high-income countries. This is the distribution of wealth I am referring to. Coronavirus has devastated the global economy and severely harmed critical pillars of society, including provision of health, education, and community activities that are key for physical and mental health. It has shown how vulnerabilities in health systems can have profound implications for health, economic progress, trust in governments, and social cohesion. We then talk vaccine equity because it will accelerate the end of the pandemic. Reaching vaccine equity will increase population immunity globally, protect health systems, enable economies to fully restart, and reduce the risk of new variants emerging. This is important because viruses, they know no boundaries, nor do they need visa to enter any country. What role can nurses play to mitigate all this? This pandemic has been marked by politicization of science and rise of misinformation. Nurses need to use their scientific knowledge of human beings, of health and disease to address these two. Several strides in the battle against pandemic were made in 2021. There was better understanding of the pandemic and the ability to detect mutation. While we were excited about these positive developments, we also noticed vaccine nationalism, thus showing global inequalities. Vaccine nationalism has robbed citizens in lower income countries of essential access to life-saving healthcare. Nurses are the backbone of healthcare services. They are the largest group of health professionals, and in addition, they are highly organized at all levels, internationally, regionally, and locally, or at a country level. Sharing our experiences is one of the ways of overcoming challenges to vaccine equity and acceptance. Sharing of information should have a purpose and not share for the sake of sharing. Nurses from the high-income countries must approach their governments and advocate for the needy countries. They must work in collaboration with NGOs and individual advocates to form strong movements around the globe. Nurses from the needy countries, too, must speak openly and honestly about their experiences and also join NGOs and individuals who are fighting for a just society in their respective countries. As Ratan Tata quote says, I quote, "If you want to walk fast, walk alone. If you want to walk far, walk together." We need to work together so that we can walk far. At an international level, we had the International Council of Nurses, ICN, and International Council of Midwives, ICM. These two global organizations exist because nurses are organized differently from country to country. In some countries, one can be a midwife without necessarily going through the nurse training program. In countries where nursing and midwifery are not regarded as separate professions, people intend to follow their passion in terms of aligning themselves with these organizations. Let this not be a barrier for nurse midwives to work together. Let it be one of our strengths. During the pandemic, we saw a lot of collaboration among different organizations and individuals working and fighting together for the good cause of their members, professions, and the population at large. ICN, ICM, and the nursing now are just one good examples of such. At country level, though, this is not always the case. We find the members of this organization almost competing, thus failing to work together. The ICN CEO Howard Cotton, when acknowledging the existence of the Nursing Now campaign, said, "It is most probable the best global campaign nursing has ever seen." We are connected now and discussing such a topic issue through the work of the Nursing Now campaign. Through this campaign, quite a number of groups have been formed. As Judith Shamian, one of the former ICN president, would put it, nursing has many bubbles. And most of time, these bubbles are not connected. The sooner we connect these bubbles, the better for nursing and midwifery and healthcare systems. It is upon these bubbles to see how best they can work together. One bubble cannot do it alone. We need each other. We all want to learn from the best so that we can be the best too. We have an opportunity. Ours is to grab it with all our hands. There are quite a number of areas where the nursing and midwifery bubbles could work together. We work together to urge our governments to implement recommendations from the State of World Nursing 2020 report, which among other things makes the following recommendation. 1, invest the massive acceleration of nursing education faculty, infrastructure, and students. This is done to meet both the domestic and global demands, respond to changing technology and advancing model of integrated health and social care. 2, create at least 6 million nursing jobs by 2030, primarily in low and middle income countries. Strengthening nurse leadership, both current and future, to ensure that these have an influential role in health policy. In a nutshell, for nurses and midwives to be a force to reckon with, for them to overcome the challenges of vaccine equity and acceptance, they need to form partnerships, work in collaboration, and be united. Policy changes and investment in nursing, gender equality, and female empowerment are in many recommendations of multinational reports. Implementation of these recommendations need all the above, including strong and visionary leadership. I would like to conclude with a quote from Florence Nightingale. He said these words as early as 1872. We are now in the 21st century, and her words are still relevant. I quote, "For us who nurse, our nursing is a theme which, unless we make progress every year, every month, every week, take my word for it, we are going back." I close quotes. Thank you very much.
Thank you so much.
Thank you very
much.
Thank you very much, Mem Tembega, for your keynote address. Colleagues, I must apologize that Mem Tembega had connectivity issues, hence she had to switch off her camera so that we are able to hear what she was saying. Thank you very much, Mem Tembega, again. Yes, indeed, vaccine equity and acceptance is important, and it will definitely improve our economies. Yes, we need to take note of the importance of nurses. As you have highlighted that nurses are the backbone of healthcare systems, and they are highly organized. Colleagues, we have heard that as nurses, we need to work together. Despite the differences that we may have in our respective countries, where in other countries, midwives are trained separately, while nurses are trained separately. Rafiat.
Hello. Thank you very much, Tembeka, for that awesome and inspiring lecture. I've learned so much from you, being a young nurse from Nigeria. One particular information that I am taking home is the fact that as nurses, we need partnership for us to be able to stand up, for us to be able to be advocates, for us to be able to take up leadership positions wherever we are. I am particularly I'm taking the partnership as a take home advice. And also I learned the importance of unity and then collaboration. It is very important and essential for young nurses to be able to collaborate with a whole lot of organizations, non-governmental organizations, to be able to stand as leaders wherever we are. Right now, we really need nurses as young leaders in healthcare and also in vaccine acceptance, so such as so as to save lives and so as to save lives. Thank you very much, Mpho. So we'll be having Rashid. Rashid is an immunization advocate who won the Nursing Now Challenge last year. Rashid will be talking about the reaching the last mile, which we'll discuss the challenges he is facing as regards vaccination in his locality. Rashid, can we have you? Hello, Rashid.
Thank you, Rafiat. Can you hear me? I hope you can see me and you can hear me.
Yes,
sorry, I'm going to switch off my video shortly because my connection is very unstable. Yeah, so sorry for that. Yeah, hello everyone. I'm Rashid Maganda, a registered nurse and midwife from Malawi. Among others, I coordinate COVID-19 activities in my district in the nursing department. I am also one of the Nursing Now Challenge Global Solution Initiative Vaccine Advocacy Champion. Today, I'm going to share about my experience in delivering COVID-19 vaccine during the aftermath of the devastating floods that has affected the southern part of our country, Malawi. So I have a brief presentation that if you can allow me, I'm going to share the presentation. Can you see the presentation?
Yes, we can.
Okay, thank you so much. Okay. So as I said, I'm going to share about COVID-19 vaccine delivery during the aftermath of the floods that has affected our district, Palombe and Malawi. So the picture at my far right is the picture of me delivering COVID-19 vaccine in one of the evacuation shelters in the district. So just an overview of COVID-19 vaccination situation during the aftermath of this devastating floods in my district. So it all started with the heavy rains that resulted into the floods. Then the government declared it as a disaster in the southern part of Malawi. Then the authorities, including us, the healthcare workers, we started responding to these devastating floods. The response included the evacuation of the victims of these floods. So there were a lot of interventions by district health office and other stakeholders. So concentration on this disaster response crippled COVID-19 preventive efforts. There was all the stakeholders, as I said, health implementing partners were concentrating much on disaster response, forgetting that we still have COVID-19 vaccine in the district. So we started observing rising in COVID-19 cases and also access to COVID-19 vaccine dramatically decreased. So this resulted in low uptake to COVID-19 vaccine in my district, Palombe. So that's when I came in as a vaccine advocate to improve access to COVID-19 vaccine to these floods affected areas. So my role was to coordinate and implement COVID-19 activities in flood affected areas. So the package included advocating and facilitating COVID-19 vaccine delivery in the evacuation shelters, addressing misinformation on COVID-19 vaccine, doing COVID-19 screening in the evacuation shelters, distribution of COVID-19 infection prevention equipments, and also general COVID-19 education. So to my far right there, you can see my colleague delivering, giving COVID-19 vaccine to one of the victims in one of the evacuation camps in the district. So during this task, we have been facing different challenges. One of it is that of impassable roads. Due to these heavy floods, some of the roads were washed away by this heavy rains. So it was literally difficult for us to deliver any health service to the affected areas. So the intervention made so far, we lobbied, we plan to lobby for a chopper from the Minister of Disaster. And because we only have the chopper for the country, only one single chopper for the country, it is prioritized to be used in some other areas that are affected, that are mostly affected. So far, we do not have any pledge or response on the choppers, and these areas remain unvisited. So we are not delivering COVID-19 vaccine in these areas. The other challenge is that of inadequate rapid response vehicles. For us to reach these hard to reach areas, we need heavy vehicles to reach these areas. But then we don't have enough vehicles to go to visit, the evacuation shelters that we have. Currently, we have 10 evacuation shelters in the district, and some other areas that are disconnected from central area here. So we have a total number of areas that we need to deliver COVID-19 vaccine as 18 in total. So on this intervention, on this challenge, we tried to engage civil society organization. On this, we have made great progress. We have received a vehicle from Global AIDS Interfaith Alliance. This is one of the organizations in my district. We also have received a vehicle one day in a week from World Vision, and another from a Hunger Project. And also we have a pledge from UNICEF to assist with the vehicle at least 3 days per week. So if we have good transportation system, we can be able to deliver COVID-19 vaccine in these affected areas, hence improving accessibility to vaccine, which will certainly improve the uptake to COVID-19 vaccine. So the other challenge is that of washed away COVID-19 vaccination card. So after giving COVID-19 vaccine to an individual, we issue COVID-19 vaccination card. I think you can see from the picture there. So because of this evidence, all the belongings of these victims were washed away, including this vaccination card. So it was challenging for us to know who has received the first dose or second dose. So some could come and claim, I received all the doses, yet they never received. So we had to do verification exercise and then provide new cards for those that already received vaccine. And for those that did not receive the vaccine, we gave them the vaccine and also issue them the vaccine, COVID-19 vaccination card. So on this, we have done, as we have made a lot of progress. We have done this almost in all the camps, and maybe remaining in few areas which are also disconnected from the central level. So the other challenge is that of washed away health passport. This is just in relation to challenge number 3. So on this one, BEIRA, which is also civil society organization, has provided us with temporary health profiles, which are used to record health information for these victims temporarily. So the other challenge is that of needs prioritization. We all understand this, that these victims have other needs apart from COVID-19 vaccine. So when we go to these camps and to deliver COVID-19 vaccine, we face a lot of resistance because they say, right now, we want food, we want clothing, we want shelter. We can't get COVID-19 vaccine now. So you should bring us food first, then you are going to give us your vaccine. You are going to give us your COVID-19 vaccine. So it has been a challenge almost in all the camps. So the intervention made so far, we have managed to engage stakeholders responsible for other needs such as hunger project, which is responsible for food in disaster circumstances. So they have managed to give food to these victims, and also the ministry responsible for disaster has managed to provide food and utensils to these victims. So we are sure if these victims get the needs they want, we can easily give them COVID-19 vaccine in the end. So the other challenge which has been outstanding even before flood disasters in my district is that of misinformation and myths. So on this one, we have done a number of interventions, including doing sensitization in COVID-19 and COVID-19 vaccine. We have also managed to paste COVID-19 vaccination information materials in all evacuation shelters. So you can see my colleagues are pasting poster which is giving out messages on COVID-19 vaccine. So from the picture there, you can see one of my colleagues from health promotion giving information on COVID-19 vaccine to the flood affected victims, and also distributing face masks to these victims. And also to far right there, you can see a poster which is saying, in local language, I have received my vaccine. When are you going to take yours? So it has been our duty to ensure that COVID-19 preventive measures are being followed in all the camps. Much as we are concentrating on other needs, we are also making sure that we do not forget COVID-19 preventive measures, including COVID-19 vaccine. This is the end of my presentation. Thank you for your attention. Rafiat, thank you.
Thank you very much, Rashid, for your presentation. We really appreciate you sharing your experiences from Malawi with us. And indeed, we can see that nurses are the backbone of healthcare system, and we are highly organized. Colleagues, what we have heard from Rashid's presentation is that, yes, we may have vaccines, but a quite number of things may hinder access to those vaccines. We have seen from the presentation that roads were worn out by the floods, so they couldn't reach some places. But they went out of their way and came with strategies to ensure that people on the ground get their shots. Rafiat.
Thank you so much, Mpho and Rashid. Rashid, you had such a wonderful presentation, and it's quite inspiring seeing the kind of work that you do in trying to bring COVID-19 vaccine to affected population, challenges, and then the solutions in which you have preferred. And I think that is so inspiring. Thank you very much. Now we'll be having Rose. Kami is also one of the National Challenge winner in 2020. She will be taking the second round of challenges in reaching vaccine equity in our community. Rose, can we have you? Hello, Rose.
Yes, thank you so much for having me. I hope you can hear me.
Yes, I can. Thank you.
So I won't be using a presentation, but I will be speaking from my heart about what we have done so far. So when we look at vaccine delivery within countries, normally our focus, where my organization is based, that is my organization, REMI East Africa, works in rural areas. It's about focusing on reaching the last mile, most especially in terms of the poorest and those who are in hard to reach areas. These populations have, unfortunately, these populations have to trek long miles to come to the vaccine centers. There are no vaccine outreaches in hard to reach areas and rural areas. So if one is disabled or cannot afford transport or cannot walk the long miles, that means they join the vaccine desert. They're not going to receive vaccines. And also, apart from trekking the long miles, when they reach the hospital, there are very few staff. And then COVID-19 vaccination was integrated together with the routine immunization, polio, and the rest, without looking at the increasing the number of staff that are available. So what has happened is that you have the same number of staff who are delivering the routine immunization, and that the same number of staff who are delivering the COVID-19 vaccines. So these are prone to errors, and so they're prone to errors, and they talk about it openly. But how they're navigating this is they're using stickers which they put, stickers which contain when they should come back and the common side effects that are seen with COVID-19 vaccination to allay the fears and anxieties of the populace, so that whenever they see them, they can come back to the hospital and then they are treated. Also because we in the urban areas, we are having outreaches for example, at schools and the rest. In the rural areas, there are no outreaches, but what the rural nurses and midwives are doing to be able to increase vaccine acceptance and coverage is by conducting community dialogues with the community to be able to allay their fears and combat misinformation around, for example, there is a current belief, for example, that the vaccine has magnetic properties. Once you have just been immunized, coins can stick to your body, and the people who have received these vaccines, for example, testify for those kind of misinformation. So what the nurses and midwives are doing, most especially in the rural areas, is to test this myth and to combat them as people come for the vaccines. Also, what we're seeing is what we're doing is to amplify the voices of these rural nurses and midwives so that they can be heard by many, and so that they can become a trusted source of information. Since normally in our population, it's normally people who are wearing white coats who are trusted, yet it's the nurses and midwives who deliver the vaccines. So for their messages and whatever information they want to pass on to the populace to be accepted, someone has to amplify their voice, and someone has to make sure that they become a trusted source. So how we are doing that is to record videos and their stories and disseminate these stories so that the people can see that this population of nurses and midwives can be trusted within the community, and to encourage them to listen to the populace more and more through the community dialogues so that they can become more of a trusted source within their communities. Otherwise, thank you so much for having me.
Thank you very much, Rose, for your presentation. Yes, in most settings, we do integrate services. And immunizations, like you're saying, COVID-19 vaccination was also, in most contexts, covered under our normal immunization programs without due consideration of staff complements in such settings. And definitely that may lead to errors, that may lead to people not functioning well, exhaustion. Yes, it is important, Rose, that you had to address myths, allay fears, and of course, making sure that people trust nurses through amplifying their voices. Remember, most healthcare systems are dominated by nurses. We therefore need members of the community to trust nurses. Thank you very much, Rose, for your presentation. Rafiat? Rafiat, are you there? It's like Rafiat is having a technical problem. Colleagues, let me invite Ms. Susan to give us or to share with us their experience from Lesotho. Ms. Susan, are you there?
Oh, yes, Ndate, I'm here.
Thank you very much. May take over.
Thank you, Ndate. Hannah, please project my presentation. Hello, is the presentation visible?
Hello, yes, I can see your screen.
Ah, okay, thank you. I'm not the one projecting, so I would, yes, thank you. This is my presentation outline. Please go on. Another slide, okay. So in Lesotho, we developed a national deployment and vaccination plan before we could vaccinate or do the real activity. That was in February because we started vaccination sessions in March the 10th with the launch of the vaccine with vaccinating the royal family. In the plan, we had looked at supply chain and regulation of the vaccine, service delivery strategies, human resource data and surveillance, as well as demand generation and promotion, and looked at the budget so that we know how much we will need in order to deploy the vaccines. We also developed the tracker capture so that we could capture the data in the system. And then we also developed the immunization cards for the clients to have after vaccination. Another slide, please. So these are the coverages for our districts. In Lesotho, we have sorry, okay, let me not go there. But this is our coverage according to districts. And we can see that at national level, we reached around 55% of our target population of 18 years and above, because this is the population that we started with when the vaccines arrived in the country. Another slide, please. For the 12 years to 17-year-olds, we started only in August with the Pfizer vaccination, because previously the vaccines that were in the country were only targeting the 18-year-olds and above. So Pfizer, we used to 12-year-olds to 17. And nationally, we have only reached 17% because by the time we started, the schools were closed. As we can see that most of this population, target population, is in schools. So we only reached 17%. And another reason for being so low was the vaccine was not enough to reach everyone. Okay, another slide. So this is the national percentage of all people that have been vaccinated. As you can see, these slides are as of the 6th March, that is last week. Another slide, please. Okay, so we started by distributing all the vaccines in the national store, vaccine store, to all the districts and the health facilities in the countries, and trained social mobilizers so that they could encourage people to come for vaccination points. We used a mixture of strategies like fixed size outreaches, mobile size, examples of workplaces, schools, village by village, and so on. And then we started off with 18 years and above on the 10th March, like I alluded before, and later on, we targeted or vaccinated the 12 to 17-year-old group. Okay, another slide. And then vaccination teams had to ride on horses to go to vaccination points that were very hard to reach in the mountains, because our country is, it has hard to reach places like mountains, like foothills. We have big rivers sometimes which are flooded and the vaccinators are unable to cross. Another slide. So, like we started the vaccination in March 2021, even today, the teams are still out in the fields vaccinating. So this brought about some burnout to the nurses and vaccinators and other team members. So even though we have been working so hard to vaccinate everyone, we still haven't vaccinated all our target population. Half of it has been vaccinated. We were supposed to vaccinate around 1,333,475, but we have only managed to vaccinate 731,409. That is why I'm saying we have only managed to vaccinate half of our targets. We can also see that we had a low vaccine uptake. Previously, it was better, but as time went on, the uptake is decreasing. We also have very hard to reach sites that can only be reached by helicopters, which we haven't reached up to now. Also, the adverse events following immunization was minimally reported. Another slide, please. So we are planning to use helicopters to reach those people that are living in very hard to reach areas. We have also revised our NDVP so that at least the campaign can pause a little bit to give the nurses and the vaccination team members a little bit of time to rest, because we have seen that there's a burnout. We also trained health workers to improve on adverse events following immunization reporting. And we are going to also intensify the social mobilization so that at least people still know that we are still vaccinating, and also the importance of vaccines so that we reach at least the target that we have set for ourselves. I think this is all from our side. Thank you very much for having me.
Thank you very much, Mayor Susan, for your presentation. And we've heard that in Lesotho, you had to sit down, come up with a national deployment, and of course, vaccination plan. Like in the case of Rashid, we can see that you have challenges to distribute vaccines to all the places in your country, to an extent that you had to resort to horses to reach some of the hard to reach areas. Well, yes, like in the case of Rashid, even you in Lesotho are considering to resort to helicopters so that you reach even the farthest places in your country. Burnout is a challenge. Rose highlighted issues of errors, and I think burnout also features in the case of Uganda. Most countries, I guess, not only in Lesotho, we are facing a challenge meeting the targets that we have set for ourselves. Low uptake, meaning we need to come up with mitigation strategies like Lesotho has done. Rafiat? Rafiat.
Hello, Mpho. Thank
Yes.
you. Thank you very much. It's so it's amazing learning about the experiences and the challenges faced in Lesotho. I mean, that is a whole lot of hard work bringing vaccines close to people. I really do applaud the health workers and the nurses over there who are trying to achieve vaccine equity, even to very hard to reach populations. Thank you very much for the presentation. So we'll be moving on to Mohamed. Mohamed is one of the National Challenge winners in 2021. And he'll be talking about reaching vulnerable communities and also sharing his own personal experiences about how he has been able to achieve vaccine equity. Mohamed, can we have you?
Yes. Good
Thank you.
afternoon.
Hello. It's a pleasure meeting you. Hello.
Hello, Rafiat. Thank you for introducing me to the challenges. Hello, everybody. My name is Muhammad Abdul Karim. I'm a community health nurse and one of the winners of Nursing Now Global Solutions regarding enhancing vaccine acceptance project. Today, I'm going to give an overview of COVID-19 vaccination in Sudan and highlight a little bit progress that has been happened in my project. Next slide, please. Sudan is one of the countries that have received a lot of COVID-19 vaccination through the COVAX facility in the Middle East North region. Since that time, Sudan is receiving more than 17 million doses of COVAX facilities aiming to vaccinate 20% of the population. Those facilities and those vaccinations aiming to vaccinate 20% of the population of Sudan has been started in 2 phases. Phase 1, aiming to reach 3% of the population. Phase 2, targeting to reach 20% of population. Despite these facts and the huge vaccination challenges, unfortunately, the target was immediate. Next slide. Challenges of COVID-19 vaccination in Sudan. There's a lot of variable challenges that affect COVID-19 vaccination in the country. One of them is political instability. Sudan is facing political instability since 2019, as now the political instability occurs again since last October that affected and impacted every work of COVID-19 vaccination. Also challenges of the cold chain system. Sudan's cold chain system has been challenging to receiving some parts of vaccination, mainly Pfizer. Also a lot of rumors about COVID-19 vaccination, mainly here are speaking rumors regarding Sinopharm vaccine, which has been produced by China, vaccine hesitancy among healthcare workers, insufficient workforce to overcome vaccination, and population habits and behavior. All these challenges contributed to the low uptake of vaccination status in Sudan. There is a huge rumors regarding vaccine uptake, mainly Sinopharm vaccine among Sudanese population, because they're thinking the origin of the vaccine is China, so that it's not safe for all to be used. Also, one of the main issues that are facing Sudanese healthcare workers, the vaccine hesitancies among healthcare workers themselves, which has been a huge variable. That all these factors contributed to low uptake of vaccine during phase 1 and phase 2. Next slide, please. So to address all these challenges, I started my project, which is enhancing vaccine acceptance in Sudan, by starting to raise an advocacy campaign and awareness about vaccine hesitancy among healthcare workers, mainly targeting nurses through focus group discussion and through technical working groups and through presentations, through social media campaigns to raise the awareness regarding vaccine acceptance. Also, social media campaign has been addressed the rumor and change the misconception, has been done. All those activities has been done in collaboration with Health Promotion Directorate and EPI program. Next slide, please. Adopted measures to increase vaccination coverage in Sudan. Despite all that challenges happening in the past, there is a few measures that has been under the table of the Ministry of Health to address the issue of vaccine acceptance. In order to address the issue of vaccine hesitancy among health workers, the Ministry of Health adopted new strategy, which one of them is linking of the salary of the healthcare workers with showing vaccination certificate. So it's compulsory to all healthcare workers to take COVID-19 vaccination, otherwise you're not going to take their salary. And this has really made a progress because the majority of healthcare workers has been increasing the number of vaccination cards. Also, through the advocacy and through collaboration with Health Promotion EPI, the ministry is shifting towards national campaign on monthly basis, despite the regular center has been allocated all the 18 states of the country. There is a campaign that has been established and started since January. This campaign is a compulsory campaign that aiming to target at least 14,000, for example, per 1 week across all the country, across all the nationwide, to prevent the issue of vaccine misconception, also the issue of vaccine expiry. Also, we're starting the poster campaign targeting that already has been vaccinated to overcome the prevent vaccine deployment. The Sudanese authorities has been started this campaign since last March to overcome the issue of AstraZeneca vaccine, which we have a lot amount of it. So we are starting booster vaccines. Booster doses are targeting mainly those people are healthcare workers and elderly people. Also, we are in the process of collaboration and discussion with Health Promotion Directorate to conduct a national survey to understand population hesitancy regarding the vaccine, because the root of the problem exists in the community. Despite all efforts and all measures, all changing of the strategies to implement vaccine accept, there is a little bit number of increasing vaccine accept. Unfortunately, we have to say that we didn't make it last year to 20% of population coverage due to a lot of issues, many of them political instability. Meanwhile, after adopting the new measures, there is slight increase during last February. We reached 33% of the population, which is quite a greater increase. That means that our new adopted measures has been used widely. Next slide, please. Progress to our COVID-19 vaccination in Sudan. The majority of people has been vaccinated is located in the Khartoum state, because the Khartoum state is the capital of Sudan and have larger population density. All of them are taking the vaccination. Unfortunately, those people are taking vaccination in the country. The majority of them are planning to travel outside for migration purpose. That means that we aren't able to reach herd immunity by immunizing 50% of the population. Also, there is mild progress toward vaccination and slight improvement of the vaccination of the vaccinated population numbers. About 3% of the population has been increased. So we as nurses here in this country try to advocate that the importance of involvement of nursing staff in the vaccine delivery at remote level and in the community level, because we believe that nurses are the closest contact to the community. Also, to minimize the overlapping of EPI routine immunization and COVID-19 vaccination, which is one of the causes of delaying the vaccination and affect other vaccination in the country, is that the responsible parties of carrying out COVID-19 vaccination are the same as doing routine immunization vaccination. There is missing balance. We can't cover all the Sudanese population due to this. So we started to conduct training sessions and training of nurses in the hospitals to carry out the vaccination by a proper way. Next slide, please. Therefore, despite all that, we believe that vaccine acceptance is a major issue that nurses could tackle upon it. From my side, I would like to prefer that nurses to be involved in the policy making and be able to make their changes through putting their thoughts and insights at policy tables in order to make a huge contribution. Despite the fact we are the closest one to the community, we are the closest one to every part of the community. We are going to understand the community. Also, we are going to administer COVID-19 vaccination by proper way. Meanwhile, sharing our experiences as from bottom to up approach is wide clearly enough to be heard at policy table in order to make a huge change in contribution in terms of whole country. Despite all these facts we are facing in Sudan, from all other economic crises and political instabilities, reaching 50% of population vaccination it will be a great advantage for us. We are planning to reach this number by next June. It's quite clear that newly adapted strategies it helps a lot by increasing number of vaccination. Thanks all. That's what I have. Over to you, Mpho.
Thank you very much, Mohamed, for giving us the taste of what is happening in Sudan. You can see that you've done it, and you've also reflected in your presentation that political instabilities has affected COVID-19 vaccination. But it is very worrying to see that there is hesitance among healthcare professionals. The country had to link their salaries to anything else. But thank you very much, Mohamed, for your period.
Thank you, Mpho. Thank you, Rashid, for your presentation. Sorry, Mohamed. Thank you, Mohamed, for your presentation. It's nice hearing your experiences from Sudan, and I think I can also I also understand the part of the vaccine hesitancy and the misinformation over there. I also feel the same challenge here in Nigeria. So it's a wonderful work you're doing in Sudan, and do keep it up. So thank you very much for all the speakers. We are moving on. We've ended the speaker session, and then we'll be moving on to the discussion part, where we all will be talking about the what we have learned from all the from the webinar, and then our personal experiences as nurses and frontline healthcare workers and providing vaccination. We'd also like to hear from the challenges that you've all been facing as regards COVID-19 vaccination in all your communities and your countries, and then the peculiarities that you have to face as regards vaccine equity. So we'll also be talking about the ways in which you can ensure vaccine acceptance on the local, regional, and global level. So we will also be taking questions and answers after our discussion. So I think I should go first. I'm a nurse from Nigeria, and then the reason why I said that the vaccine hesitancy and misinformation is very prominent in Nigeria, because a lot of people do think that the vaccines are fake, and then it's a way in which Africans will be manipulated as time goes on. So it's a whole lot of challenges trying to debunk misinformation, and then trying to encourage people to go for the COVID-19 vaccine. Also, challenging experience that we've had as nurses is the fact that a whole lot of people, indigenous people, do not believe that there's COVID-19 at all. A lot of Nigerians believe that COVID-19 does not exist, because I've personally had experiences of people talking about the fact that they've never seen people die of COVID-19, and then it's always it's a fake information, it's a fake news. So there's a whole lot of expenses and investments taken into trying to debunk misinformation, and then trying to encourage people to go for their vaccination. So I will be taking it back to Mpho. You might want to share some of your challenges and then your personal experiences as a frontline worker in Lesotho.
Thank you very much, Rafiat. Like I said, or like we have heard from Mayor Susan, one of our nurse leaders from the EPI program in Lesotho, we still have a problem with COVID-19 vaccine uptake. You probably have seen from a presentation that the country had said itself that by now it should have vaccinated half of the population. But from the presentation, we have only managed to vaccinate half of what has been targeted. So we are far behind our target. Well, like in any other countries, in fact, most African countries, our challenges goes with inaccessible places. If you consider our country, like Mayor Susan has just shared with us in her presentation, the country divided into 3 parts: highlands, foothills, and lowlands. And most of our vaccinated population will definitely come from the lowlands, where healthcare facilities can be easily accessed. When you go into the mountains, those hard to reach areas, that is where you need to ride a horse to get to some of our health posts, where you will find people who may need to be vaccinated. So such challenges are the ones that are hindering are the ones that make us to fail to meet the targets like Susan has reflected. Well, yes, it's a known fact that we need to collaborate with military, we need to collaborate with everyone if we want to see this initiative being successful. Hence, the Ministry of Health, like Susan has reflected, it's partnering with other ministries, especially the Ministry of Defense, which is the custodian of all these helicopters. So there's that collaboration that will facilitate a promotion of vaccination in those hard to reach areas. Susan, can you add anything on what I've said?
Yes. Thank you so much for sharing your experience from Lesotho. I'm learning new things. Now I know that your country is divided in 3 parts, and then all the efforts that you've made. So there's a question on the question box, and then okay, Sally is asking about how much does social media impact upon the anti-vaxxer opinions in your country. So I'm thinking the question is about the impact of social media on the opinion of anti-vaxxers, on the opinion of the general population in each of the countries. I don't know, Mohamed, can you share your experience about your knowledge and your opinion about how social media can impact different people in Sudan? Hello, Mohamed, are you there? Okay.
Yeah, thank you, Rafiat. From my side, I do believe that social media is a weapon that we can use it wisely to influence and impact our communities. Because when we use social media to correct misconceptions regarding COVID-19, for us personally in Sudan, during last 2 months, when we start to use a campaign to raise the awareness regarding COVID-19 vaccination, also they're asking the rumor questions and to assess to hear from the social media followers. We are able to change a lot of anti-vaccine populations. They came to get their vaccination. Also, we are trying to push to using a posters to highlight that who said Pfizer vaccine is not working in Sudan? Who said this vaccine is not working for certain age group, for example? Who says vaccine is not safe for children? Then we are assessing their perceptions. Then we are going to correct their misconceptions regarding the COVID-19 vaccination in the media. Also, we are using you are using a mobile ring period to the call to everyone to hear about the importance of taking vaccination. So the number of the vaccinated people after using social media has been quite increased, and that's why I'm that social media is a weapon that we can use it wisely to increase vaccine uptake, also to convince vaccine hesitants to get their vaccination. That's all I have. Thank you.
Okay. Thank you, Mohamed. Rose, are you there? Hello, Rose.
Yes, I'm there.
Oh, thank you very much. I would really like to hear your opinion about the impact of social media on the work that you do. And then I understand that you've also been training health workers about storytelling and then improving the advocacy skills. So how do you think that could also assist, or how do you think that could help in reducing vaccine hesitancy from social media?
I think from our end, stories help to engage the people, and social media helps to amplify that engagement with the public. And so, as you may know, that once you can be able to create a communication with the public, then you're able to know where their stand is against certain issues. And but because Facebook was blocked in our country, so people who utilize Facebook have to utilize VPN. We normally utilize Twitter and YouTube to engage the audience. it's normally the land population, the elites who are on Twitter and YouTube. So it's somehow like speaking to the cloud. So we try and balance that with the community dialogues, which the healthcare workers are having in the community. If they were not there, then that balance would be lost. So social media is good, but we must be knowing whom we are targeting on social media. Are we already targeting the choir who already knows exactly what vaccine equity is and acceptance is, or we are targeting people who do not know, and or the poorest who cannot even read or write? Or are we also targeting, and how are we also reaching the people who do not have smartphones, who are the poorest, who are really the last mile in all of it all? So that's my thinking.
Thank you very much. Thank you very much, Rose. I think that's a very important aspect that you pointed out. So, Tembeka, hello.
Hello.
Hello, Tembeka.
Hello.
Oh, yes, yes. So I'm thinking, what could be the relationship between social inequality and vaccine acceptance? Because there has been a whole lot of discussion about social inequality, and then people from low income countries, and then or people who are in hard-to-reach communities usually have this level of low vaccination. So I really would want you to talk about the impact of social inequality and then vaccine acceptance.
Yeah, let me start sharing with you with experience in South Africa when it comes to social media. We have observed that the vaccine uptake is very poor amongst the young people. Why young people? Because they are the ones that are using the social media a lot. The highest group of people that have been vaccinated, that have got a high percentage of vaccination, are the people that are above 6 years of age. Why? It's because they're my group, we're not so much dependent on social media. And as a result, the government is now using a lot of young people to be the one that are advocating for vaccination. And in addition to that, they are using the so-called people that are working in the TVs, celebrities. They call them celebrities, because young people also believe so much in those young people that appear in TVs. So that's the ones that are mostly used to advocate for vaccination. So that is the strategy the government that is using. Now, coming to social income, you know, they always say in the world, there are 3 groups of people that are vulnerable or that are gullible when there is misinformation, or they are gullible when it comes to, when it comes to misinformation, be it science misinformation, politics, and so forth. What are those groups? Firstly, it is women. Secondly, it is the young people. And thirdly, it is the people that have got a low standard of education. Now, coming to social income, obviously the people that fall in that category of low social income are the people that, they fall in those categories that are gullible. Hence, they are more likely to listen to this misinformation, because for some reason we've been actually saying in South Africa, and in the main, people blaming the government, that when it comes to the messages, they're not as strong as the messages of the anti-vax. So if the anti-vax, they've used the social media and other strategies to communicate their views, and their strategies, actually, they beat the ones that are used by the government. So you are obviously going to experience a low uptake of vaccination. So that's my take in that. And that's why for me, I am saying, nurses, we are in direct contact with the people, be it especially those that are vulnerable. Who are vulnerable are people in the rural areas. In South Africa, you never get a medical doctor in a village, in a rural areas, having a practice there. But you always find a clinic, you'll find a nurse. And therefore, what also I've observed in this seminar is that we are really now going back to the basic of nursing and nurses. Nurses, and we've been complaining, especially people of my age, that somehow in the middle of things, nurses have lost that advocacy role that used to be so prominent in the past. I'm very happy that there is this now, that the Nursing Now Challenge has picked it up, because we have to improve that advocacy role of ours, because we are the ones that are really in touch with the community more than any other person. Thank you very much, Rafiat.
Thank you very much for that wonderful speech. I've learned quite a lot, and then I am very certain that nurses should start learning to go to the basics, to reach out to people, to have direct conversation with people, to have a very important way in which we can pull people into good health, into seeking good health and well-being, and also taking vaccination. We are the closest to the community. We are trusted, and then I think one of the speakers mentioned about nurses being one organized profession. So we really need to take up these qualities and use that as one of our weapons in which we can take up leadership roles in healthcare systems, and also help influence COVID-19 vaccination acceptance wherever we have. Thank you very much. Mpho, I don't know, do you have something to say, to discuss about? Mpho?
Thank you very much, Rafiat. You have tried to cover it all, and I think our presenters have addressed your questions and the way you have engaged them. I really appreciate that. I don't know if Ms. Susan, you would want to share anything, any reaction with regards to social media and other forms of communication in Lesotho? Ms. Susan?
Thank you, Ndate. I think what the colleagues from other countries have shared is similar to Lesotho. We know nowadays people are engaging a lot in media. So they have read, they have heard, they communication and misinformation and misconceptions about the vaccines. Some have heard that the vaccine is going to change their DNAs. Some have heard that they are going to have the 666 or the mark of the beast. These are the myths that people have heard, and as a result, have not come for vaccination. They have denied to be vaccinated. Most of those who are engaging in social media. So this is, I think, similar to other countries. Thank you, Ndad.
Thank you very much, Ms. Susan, for sharing with us how social media is influencing vaccination in your country. Colleagues, we have had the presentation from Tembega giving us the keynote address. I don't know if there are any reactions to what she highlighted, any questions or whatsoever. Otherwise, any other specific questions to our presenters so that they could react to or respond to your questions, we will highly appreciate those. If you type them, then we'll ask our presenters those questions.
Thank you, Mpho. So we'll be welcoming questions right now. If you have any questions for our keynote speaker or to any of the speakers on the webinar, you can simply type it and then send it to the question and answer box. So we're waiting for our questions, and then we welcome different contributions. Oh, so I will be asking Vince. Vince, are you? Hello, Vince.
Yes, I'm here.
Hello. It's a pleasure speaking with you. So I want to ask you about your experience with immunization advocacy. And then I want to ask about your opinion about mentorship and training for nurses as regards how to improve their advocacy skills, and take up leadership roles in their communities, because I really do understand that for nurses to be leaders, for nurses to influence policies and be leaders wherever they are, they need some certain level of training, they need some certain level of mentorship. So I'm wondering if you could say a little bit about that.
Sure, absolutely, Rafiat, and thank you all for such an amazing webinar today and set of presentations. It was really fascinating to hear some of the challenges and the common threads that come in. And as you say, Rafiat, it's so important, and it was highlighted throughout many people's talks today, about about how important it is for nurses and midwives to lend their voices as to what's happening in their communities, and maybe just to underscore that a little bit. I mean, we're now 2 years into the COVID-19 pandemic. I think maybe if there's one collective word, the entire world feels it's exhaustion, right? And the exhaustion of this has led to so many of the kind of social strifes, wars, other things that are happening now, and I think that Susan put it, the burnout of health workers is a major part of that. Health workers had to, at the beginning of the pandemic, they had to completely adjust how they worked. Many of them were without proper protective gear, had to risk their own safety daily, had to navigate different procedures of lockdowns and other sort of mitigation measures that were taken. That all happened. Then vaccines came out. High-income countries hoarded a lot of the vaccine distribution in the first year. There's a lot of advocacy that was needed to try to push and address those supply inequities that happened in 2021. It took way too long, but we're finally starting to get some of the supplies needed on COVID-19 vaccines. But now there's a lot of the cost of this was huge to every community in the world. The variants rose out of communities that had little to no access to COVID-19 vaccines at the time, and will continue. And these the lack of COVID-19 vaccination continues to equitable vaccine, COVID-19 vaccine distribution continues to really drive the pandemic. And so at the same time, nurses, community doctors, pharmacists, midwives have been, despite all these challenges, have really delivered. I mean, I was just looking on the Bloomberg tracker, there's been more than 10.9 billion doses across 184 countries delivered in about 2 years. That's an average of over 22 million a day. So nurses have continued to deliver, but as we heard today, there's so many different challenges, both sort of delivery challenges. Mohamed and Rashid went over some of those, but also those challenges that that misinformation, that kind of a collective exhaustion people have had, the challenge of communicating about a respiratory virus that has some similarities to other respiratory diseases. All of those things are so challenging, and so it's so important that these stories be heard by policymakers, because in the coming year there's so much funding going into the delivery of vaccines, both from kind of global and international donors and by national campaigns. And these are only going to be successful if some of the stories that we heard today are really heard and understood by people, by those who are setting policies at the local district level, at the national level, at the global level. And so it's really, really important that people continue to engage in their own communities, and also I think really take part in their national associations of nurses and midwives, really continue to try to raise these issues of vaccine equities, and really advocate for what health workers need. And some of that is just that support and investment in their salaries and the support that they regularly need to be able to deliver these vaccines, because we know health workers can do it. We've seen them. We've seen all of you do it, and you will continue to do it. But you know, the rest of the world has to deliver what you need, and so really hope that you all can continue these conversations. I really enjoyed it today, and you know, happy to continue you know, in dialogue with different opportunities there are going forward.
Thank you very much, Vince. Thank you, Vince, and thank you, colleagues. And I must say, it was a very fruitful meeting for us all. We have discussed issues at global level. We have heard what's happening in our different regions and countries. Most importantly, colleagues, vaccine equity and acceptance is important. Why? Because it impacts on our country's economies, and nurses being in the forefront, we need to invest in nursing so that we see vaccination being successful. We have heard that in different countries we have challenges, but there are strategies that we can employ to overcome those challenges. We have heard that in other countries, lobbying is very important. We need to engage our leaders. We need to engage our politicians so that this vaccination becomes a success. Yes, we need to integrate immunization services, but we should be careful that we do not fuel burnout. We should also make sure that we don't end up seeing errors. Rafiat, your last words, please.
Thank you very much, Mpho. Thank you. I really do appreciate our speakers and then those that have been able to join us for this webinar. So my take home is the fact that nurses are leaders. Nurses are the arts of the healthcare system, and then without nurses, there's really nothing that the world would be able to achieve as regards improving the health of everyone. I I would really implore all nurses to involve in policy making and to also share their voice as regards to whatever they need. Just like Vince has said, it is very important that even as we work, even as we try to improve the situations that we find ourselves, we should also be able to speak up as to what we need, the kind of support that we need, and then how we should all be involved in providing solutions to each of the challenges that we all face. So thank you very much for the speakers, and it's a wonderful evening from me here from Nigeria. So we'll be ending the webinar, and it's a bye from me.
Bye.
Please stay tuned for more webinars to come. Please stay tuned for more webinars to come. Looking forward to seeing you in our next session. Bye-bye.
Bye.
Thank you and bye.
Bye.